Hello and welcome to the latest edition of Health with Sneha, where I talk about all things concerning health. And this week has been of particular concern, given that once again we have a public health emergency of international concern as declared by the World Health Organization's 16-member committee that does so each time. It has done this in the year 2009, it has done so in the year 2014, in the year 2016, once again in the year 2020 when it declared COVID-19 a public health emergency of international concern on the 30th of January 2020, and then went on to declare it a pandemic almost 2 months later. But what exactly is a public health emergency of international concern, and why is the monkeypox a global health emergency? To talk about that and much more, what should you be doing, what should be the precautions you should be taking, I have with me Dr. Chandrakant, Lahariya, a well-known epidemiologist, and Dr. Rajeev Jayadevan is also now joining us. Thank you both for your time. Dr. Lahariya, I want to begin by asking you, there are questions being raised right now within the medical community that this wasn't a public health emergency of international concern. I know a lot of people have been saying that we need the world to sit up and take notice, when many are saying that this didn't really fall in the category of a public health emergency of international concern. What are your views in that?
What we need to remember that when a disease is spread to an additional geographical area and when it becomes a risk to the additional population groups, it is up to the expert to arrive on a consensus how to define it. In the last 12 or 13 years, 7 times World Health Organization had declared public health emergencies of international concern. There are specific objective and purpose of making such declaration or such designation to a disease condition. Mm-hmm. What we should, there is a clarity that there was no consensus in the main committee whether it should be a public health emergency of international concern or not. There were clearly articulated arguments both for and against. Mm-hmm. But what we need to remember that disease has spread to many countries where this was never ever reported, and it is continuously being reported in additional settings. And having declared a certain condition as a public health emergency or international concern has some advantage of it brings attention to the nations to act upon it, which often some of the nations do not do. It also gives opportunity for international collaboration, and specifically in context of monkeypox, because it's a new disease for many countries. Fortunately, there are some vaccines against smallpox which can be used for monkeypox, and then a medicine which is available. Once it is being designated as public health emergency of international concern, this gives opportunity to the country to boost up their surveillance system. It also empowers World Health Organization to seek some of the information which otherwise would not be shared with them. It also gives opportunity for sharing the vaccines and also additional production of therapy. So in my opinion, rather than going into whether it was or it was not, more important is that it provides an opportunity to effectively tackle a disease which is new to the many settings, and that's what matters.
You know, Dr. Jayadevan, many questions are being asked now, and it's obvious to draw comparisons with COVID-19. But the most common question that I've been asked actually is that, will masking help in preventing from, a person from getting this infection from an infected person?
Well, any of the precautions that we follow for the COVID-19 pandemic will by default help with the reduction of any other infectious disease. For example, monkeypox is no exception. Rarely, it can actually go through respiratory droplets, even though skin-to-skin contact is the most common method of transfer, or skin to mucous membrane contact. If you keep a distance from the next person, and if you wear a mask, you will not pick up even the common cold, the influenza, the rhinovirus, diarrheal diseases. There are also two diseases that you can keep away, and monkeypox happens to be one of them. But there is no need to panic about this fake PHEIC as PHEIC or public health emergency of international concern. As Dr. Lahariya said, it is a technical term. It does not mean this is a pandemic. I think many people tend to confuse that a PHEIC is a pandemic. It is not. It simply means, as exactly as he said, a something for the world to sit up and take notice and take certain actions together.
Dr. Lahariya, what should those actions be at an individual level to keep the infection at bay, given that it is spreading, and we also know that even before the rashes appear, the person or the patient is already fairly infectious to transmit the disease?
So I understand that there is a lot of concern and apprehensions, especially after the world has gone through SARS-CoV-2 or COVID-19 in the last 2 years and few months. So people are apprehensive. So most important at the individual level is not to panic, not to worry. This is a very different virus than the SARS-CoV-2. SARS-CoV-2 has a main mode of transmission as respiratory virus. This is not a respiratory virus. So we know this is more of a skin-to-skin condition, or body fluids are required. That's one part. So first be assured, do not panic, do not worry. Second point to remember is that unlike SARS-CoV-2 or COVID-19 disease virus, which can spread from an individual who is asymptomatic or without symptoms, or let me put it in simple terms, individual without symptoms in SARS-CoV-2 can pass on to other individual who can develop full-fledged disease. But that is not the case with monkeypox. In monkeypox, to be infectious, individual need to have symptoms, and then only he can pass on. So we can identify the case of monkeypox relatively easier, and likelihood of transmission is less. Having said that, what we need to remember that while at the national level, governments need to take action to prevent the spread or transmission, but at the individual level, everyone need not to worry immediately. If a virus has been detected in Kerala or Delhi, does not mean somebody who is living in Sholapur in Maharashtra or a remote village in Odisha need to worry. The virus is still at the early stage. That's one. Second part is that if one can only, the probability of getting monkeypox is only when either person has a travel history or a contact history with someone who has traveled. So unless these two conditions are fulfilled, or additional condition could be said that if a virus is circulating in your local community. So unless these three conditions are fulfilled, do not think that any fever or pox or pox or rashes, etc. is monkeypox. So monkeypox has a specific condition. Important is that we are aware about these conditions. What are the symptoms? Symptoms are very similar to any other viral illnesses: fever, malaise, generalized body ache, fatigue. All of these happens in viral illnesses. Two things are very characteristic, and these two things, symptoms should be seen in coherence with the travel history, contact history, or local circulation. Then only, if the person has some specific type of rashes, or person has a lymphadenopathy, which means that the glands in the body, armpit and other parts of body are swollen. So those raise the suspicion of monkeypox.
You know, Dr. Lahariya, two questions I want to ask you. I've just made my notes very quickly. You said that if the patient is not showing symptoms, which means that at that point in time, he can't be transmitting the infection. So if he's asymptomatic, he will not be transmitting the infection. Am I correct?
That's very correct. So if a person is asymptomatic, that person is not infectious. Infectiousness start, or the ability to transmit start only when person start developing any symptom, be it fever or rash, other marks.
You know, also, the thing with COVID is that there have been community transmission. I mean, the government of India may not accept it till this date, but there has been. And with the case of monkeypox, there have been no cases of community transmission or any sort of a cluster infection found in any group, isn't it? So there is some reason to be.
Well, for India, For India, it's difficult to say because there are very few cases, but in other settings where number of cases are high, like in Spain, Denmark, or United States, that situation might have arrived. But that is more of a operational or programmatic intervention. What we know that cases are being reported from multiple settings, and there is need for taking programmatic actions or interventions.
You know, Dr. Rajeev, I want to ask you, what in your sense are the precautions precautions, a lot of people say, what should I do? One of the things that you said was that masking may protect to an extent, because it will protect you against viruses in general. So we can just continue to wear these masks. But because monkeypox is different, what are the other precautions should one be taking to ensure that they don't get the infection?
Yeah, firstly, you will not pick up monkeypox if you sit with somebody on a bus, or go to a government office, or go to school, or walk along the road. That's not going to happen. So I think people should understand that. Second is, it's not spread by monkeys. That's also very important. When you see a monkey in the neighborhood, they tend to live where people live. So they're peaceful animals. They do their business. But there's no need to chase them away or harm them. These are all possibilities, because there's plenty of misinformation circulating about animals spreading. Right now, it's a human-to-human spread. And as to where we can pick it up from, as Dr. Lahariya said, it is primarily by sexual contact. Even though it is not officially called a sexually transmitted disease, the vast majority of cases are among men who have sex with other men, and it could either arise as a result of the act or as a result of close physical contact. And people who are not directly or indirectly engaging in this behavior are extremely unlikely to pick it up. The exception is if you have a partner and your partner is engaging in that behavior and you're not aware of that. And that could potentially lead to your spread. Otherwise, for most, let's say, most couples who are living together, this poses no concern as long as they are not connected with such networks. Now, when the additional precaution I will add is that I'm aware that some people travel for pleasure to either to other towns or to other countries. I would be really cautious, because this virus has reached many such circuits. So even if you go for something like a massage, which involves a lot of body contact, the disease could potentially spread. So one must use some discretion, especially until we know that the disease has quietened down. I'm aware of cases that have occurred in this fashion as well. And that's also to say that one additional point is linen. If you, for example, look at the linen that was used, or the bed sheets or clothes that were used by a person whose skin was actively involved, who had many skin lesions, yes, there will be enormous amounts of virus on these sheets and clothes. And if we come into substantial contact with them, yes, we could pick up the disease. One other case report that's come up from England is when linen was dusted. When we remove the sheet of a bed, we tend to shuffle the linen a little bit just to smoothen things out, and that itself can release dust into the air. And these pox viruses have a reputation for living for several weeks alive, if you will, in dust-like particles. So special precaution to be taken while handling the linen of patients. So those are all things that are evolving. I think we will get more information as we get more research done into exactly how so many people were infected. So as of now, the general public, no need to worry. For people who are traveling for these purposes, be very careful, use your discretion. People who don't have many partners, they don't have to worry at this time.
All right. Dr. Lahariya, a lot is being said about how one should be looking at, smallpox vaccinations. A lot of doctors and infectious disease specialists have said that this is the time now to then ensure that there is a stockpile of smallpox vaccines. Do you think we can do that? We should be doing that?
So what we know that second generation and third generation smallpox vaccines are protected against, are recommended against monkeypox. This would be called, these are approved, these smallpox vaccines are approved or given emergency authorization in some countries, but other countries which have not authorized, this would be called off-label use. And their role in protecting monkeypox is proven. However, we also need to remember that currently even by World Health Organization, the mass vaccination by smallpox vaccine is not recommended.
Okay.
There is some role of what is termed as a ring vaccination with the smallpox vaccine, and this ring vaccination is for the in contacts who are around the confirmed case of monkeypox, and that can be utilized. But we also need to be mindful that every setting does not immediately need this vaccine, and these vaccines are immediately available in some countries in Europe, United States, and Japan. So what is required as a public health preparedness that every country, including India, need to think of that how to procure some amount of vaccine, which population group should be prioritized for this thing, and how vaccine will be used. But we also need to remember that even at the global level, total production of these vaccines is very limited, and this should be going to those settings where the majority of cases are being reported. So in summary, my answer is that yes, the Indian authorities and Indian government and technical expert group on vaccination should be reviewing about the need for possible use of a smallpox vaccine against monkeypox. Government should also exploring how to secure or procure some amount of vaccine, which could vary whatever amount is possible. And third is that once such vaccines are available, which population group should be vaccinated. Of course, there would be need for vaccinating some of the people, or it will be a good public health intervention to vaccinate those who would be involved in care of the monkeypox cases. Mm-hmm. But I want to give a flag that 4 cases have been reported from India till now, and a few more cases can be reported in days ahead, months, and cases might be reported in months ahead. But this automatically does not become a situation for vaccination of even a bigger group. We should not panic that vaccine is not available. And final point here to remember is that fortunately, the currently circulating variant, there are 2 types of this monkeypox virus, West African clade and Central African clade. The currently circulating clade is relatively mild, self-limiting, as we can understand that outside Africa, outside those non-endemic countries, though around 15,500 laboratory confirmed cases have been reported, fortunately no death has been reported. So it's really mild illness. There is no need to panic. But yes, of course, be prepared. And that's how you handle outbreaks and epidemics.
Okay, I wanted to ask you, you spoke about ring vaccination, which is a strategy extremely different from COVID-19. Dr. Jayadevan, in COVID-19, we've resorted to, vaccinating almost the entire population, barring those below the age of 12. That has not been permitted yet in India. But by and large in COVID-19, we're vaccinating everyone, even boosting them. But here, the strategy is a little different. Also, I want to tell our viewers and also double check this with you, Dr. Jayadevan, that if you've been exposed, unlike COVID-19, then vaccinating beforehand helps in the case of monkeypox.
Yes. Again, as Dr. Lahariya said, this is not a case for vaccinating the whole population at all. There is no such move at all, and there are no discussions in that regard. It is only, for example, to protect someone. Say, for example, you're working in a sexual health clinic. Seeing a patients as a healthcare worker, you want to protect yourself. So that is a situation where you really want to get vaccinated because, as all of us know, vaccines are like any other products. They do have their share of side effects, which are quite uncommon, but when they do occur, some of them can be quite severe. So any medical product, regardless of whether it's vaccine or antibiotic or painkiller, must be used with discretion. And as far as monkeypox goes, it's a case of balancing the risk and benefit. So the general population is not at risk for this. There is no need to vaccinate the general population at this time. No move in that direction. There are 2 vaccines, as mentioned, and they can be used for up to 2 weeks after exposure. So that gives a little bit of comfort that you could get vaccinated if you wish, even if you've been exposed or if you think you've been exposed to monkeypox. These vaccines don't stop the infection fully. We don't have human trials on the new monkeypox vaccine yet. So there's not a lot of data on its use in in actual patients, but it's believed that both these vaccines, which are related to the vaccinia virus, which is basically a cousin of the smallpox virus, the vaccinia virus is used in its inactivated form, and that has some cross-reactivity with the monkeypox virus, and it's believed that they will make the disease milder. And especially so for vulnerable people, for example, if there's a pregnant woman who's been exposed, that person is at greater risk because pregnancy carries great risk for so many other conditions, and monkeypox is no exception. So these are some thoughts. Again, I think the public should not really panic into thinking that I need to go and get a smallpox shot. No, that is not true at all.
Okay, very important point you make. My last question, and that is to Dr. Lahariya. A lot of people ask, will there be a situation where we are seeing a lot of infection around us and there will be lockdowns once again? What do you have to say, Dr. Lahariya?
Oh, I'm very clear about that. So there would not be any lockdown due to monkeypox. Monkeypox is unlikely to become pandemic. There is not a scenario in which there would be lot many cases who would require medical care. What we know that once a virus has been detected in different setting and the way it is spreading, it is very likely that more cases would be reported. It is also very much possible that the virus would be regularly reported afterward. We can look back about Zika virus. Zika was almost unheard before 2016, and even till last year in India, we usually used to count outbreaks like Kerala, Maharashtra, and Uttar Pradesh reported some Zika cases. But now there is evidence from Indian Council of Medical Research study that Zika virus has been detected in multiple settings. So in the public health effort remains that new pathogens are prevented from spreading to additional settings. But once they are reported, it is very likely that they stay. While the viruses especially stay in that setting. So now monkeypox is in India and many other settings. Fortunately, it's a mild illness, but it's unlikely to disappear and go away. Cases would be reported, but cases because of the pathology, it's a contact illness with the close physical contact and coming in touch with the bodily fluids and secretions, then only to spread, and that's why it's unlikely to become a major challenge. And final point here is that often we are making this mistake of comparing with the COVID-19, but what we need to remember that two things which are three things which are very particular. One, COVID-19 or SARS-CoV-2 is a respiratory illness. Respiratory illness is transmitted very differently. This is not a respiratory illness, it's a different one. That's one. Second part is that SARS-CoV-2 is a RNA virus, which are very prone to mutate and new variants emerge, and that makes it difficult for body to defend against this thing. But this is a stable DNA virus, doesn't change, so that's the second part. Third is that SARS-CoV-2, asymptomatic individual can pass on. Fortunately, in monkeypox, asymptomatic individual do not pass on. So with these three things, three differences, it's unlikely to become a pandemic. There are many other reasons as well.
All right. Thank you so much, Dr. Lahariya. That was really informative. And Dr. Rajeev Jayadevan, your views are always accepted, are always respected. And it was great having a conversation with you on monkeypox, because there are so many myths and there are so many questions that everyone is asking. Of course, everyone is fed up of the current pandemic. 3 years on, we've been living with COVID-19, and now we have another virus, another infection hanging like a sword on our heads. There have been concerns. How does it really spread? Do masks help to an extent? I hope our viewers have got a sense of, by and large, of what this infection really is and what they can do to protect themselves. Thank you so much for connecting with us, Dr. Lahariya, Dr. Rajeev Jayadevan.